This program is for informational purposes and is to be used along with the instructions provided by your physician. Hello, my name is Emma, Family Resource Nurse at the Children's Hospital at St. Francis. This series of videos will give you the information you need to recognize, treat, and prevent future asthma attacks. In this video series, you will learn how to manage your child's asthma, about some asthma triggers, and how to use a spacer and inhaler. You will also learn how to use your child's asthma action plan. You may have just learned that your child has asthma, or your child may have had asthma symptoms for a long time, but they are not well controlled. This may be a first-time wheezing episode for your child, and while it might not be considered asthma yet, it is a reactive airway problem that is similar to asthma attacks. The definition of asthma is repeated reactive airway or wheezing episodes. Your child may have allergies, a history of RSV, or pneumonia. Symptoms such as coughing, wheezing, and shortness of breath can be triggered by many things, including pollen, mold, smoke, dust, weather changes, and viral infections. This video will help you know what is going on inside your child's body and how you can intervene. Asthma is a long-term problem that cannot be cured, but can be managed through education, medication, and lifestyle modifications. Let's look at what happens in the lungs during an asthma attack.
This is Dr. Jeffrey Rice with Warren Clinic Springer Pediatrics, here to speak with you today about the lungs and asthma. These are the lungs. This is the main airway that goes down your throat and branches into two main airways in your lung. At the end of each small airway is an air sac. Oxygen gets into the blood by way of these air sacs, and it's very important to keep them open and functioning. There's three things that happen during an asthma attack. There's airway swelling, mucus production, and muscle tightening. All of these causes the airway to narrow, thus leading to asthma attacks. What does this look like in your child? At this stage, your child may not show very obvious symptoms. As a matter of fact, they may just have a dry cough or a nighttime cough. Look at your child's chest as they breathe. Breathing faster in a younger child is a clear symptom, and breathing deeper in an older child may be a symptom. Later, you will learn about an asthma action plan. Your doctor might prescribe a quick relief medication such as albuterol to help with these early symptoms of an asthma attack. The quick relief medication relaxes the muscles around the airway to open it up so your child can actually breathe better. The next stage of an asthma attack is more reaction, more swelling, and more tightness. Now the airways are narrower and it's harder to get air in and out. Your child's dry cough will become more persistent. Again, look at your child's chest. You may notice that the areas between the ribs, bottom of the rib cage, or the muscles near the neck are actually pulling in with each breath. This is called retractions. Your child's breathing might be faster and you might hear some wheezing. The late stages of an asthma attack can be very severe and can be life-threatening. Airways now become blocked because of the tightness, the mucus, and the swelling. Your child may not want to eat, drink, walk, or even talk due to the difficulty breathing. So when you look at your child's chest, you will notice that their retractions are getting worse. You may notice the belly pushing out while the rib cage is actually pulling in. You also may see that they are flaring their nose, or their muscles around their neck are actually pulling in as well. These are all severe symptoms and may be an attempt to get as much air as possible. Your child might have a look of distress on their face. Older children may lean forward with their hands on their knees, and this is actually something called tripoding. Your child's wheezing may actually be quieter because there's no air moving through the lungs. If you see any of these signs, these are very late symptoms and need to be assessed immediately. Any of these symptoms is an emergency, so bring the child to the ER or call 911. If your child is constantly requiring treatments more than every 4 hours at home, you should call your doctor immediately. Your child might need more medicine or needs to be assessed in the office or even be seen in the ER.
Now you know the early signs of an asthma attack and how to treat it. Remember to take action early and don't wait until you hear wheezing to start treatments. Start your action plan as soon as you hear a dry cough. Continue to video number 2 to learn more about things that can trigger an asthma attack.